It's 5 o'clock. I'd like to call a meeting of the Health and Human Services Board at the St. Croix Government Center to order at 5 p.m. Roll call, please.
Julie Smith.
Present.
Kathleen Finley is excused. Lisa Lind.
Present.
Sean Anderson is excused. Kathy Leaf.
Present.
Dave Osnes. Present. Greg Telejohn.
Present.
Mike Barkalow.
Present.
Deb Lindeman.
Present.
Thank you. Minutes were circulated with the agenda. If there's no objections or corrections or anything, the minutes will stand approved as presented. They're approved. Public comment. Any public comment? Scott? Okay. Business items, Health and Human Services monthly financials. Faye?
Good evening. So the financials in your packet are through February of 2024. When you look at the first page here on page 7 of the packet, we have not received any of our state funds yet. We just this month started submitting our January and February claims. So we won't see any of that money until next month. We have been getting in our local collections, and those are actually a little bit ahead of where they were at the same time last year. So that's good news. When we go to page 8 of the packet, you'll see we already have a negative balance. This was specifically for sober living. It's part of our state opioid response grant. So that was an additional line item that we had added to the grant that we didn't budget money for, but we do have funds that are covering that expense. And then you'll see something similar further down on page 9. We have 2 negative amounts already. One was rental assistance that we used with our mental health supplemental block grant, and then the other, the $3,000 in the instructional aids. That was some of our substance use supplemental block grants, so prevention dollars that we use to cover those. When we get to page 10, when you look at our 2023 final number, that's the same as it was last month, so that's a manual update that we have to do to update 23 numbers. So that has changed a little bit since last month. That will continue to change over the next couple of months, so I'll work with Dustin to make sure that's reflected when he runs the reports next month. And then I think, is there questions on any of the human services? So I'll skip down to our nursing home. And if we go down to page 23, nursing home census has been running a little bit higher than it was last year. We're running 35, 36, and you can see that reflected already in the revenues. So we're almost 300,000 higher than we were last year at the same time. They continue to use pool staff, so you'll see that amount reflected too when you're looking at those expenses. But overall, they're showing a positive balance right now. So, any questions? Oh, Dave?
With the additional folks now that we're seeing coming in up there, which is really nice to see, how are we doing staff-wise right now?
So again, we're utilizing pool staff when we need to cover those. So I've seen some hires come through more on the CNA side. I know they went to the job fairs and stuff with HSHS closing, but I don't know that we saw any nursing or other things result from that. But we have the job postings, you know, they've worked with human resources on the wage grids. And otherwise, we have the contracts with our pool organizations to cover the staffing that we need.
I think the other nice thing we've got going on up there too is with the classes that we've got up there. We've got a lot of the high school kids that are taking the classes that are sticking around and helping out staff too. And that was one positive thing I've heard for a long time, that without those kids, they don't know what they'd be doing right now. So they're helping us out, and we appreciate that. Yeah,
I did hear just the next class, there was only like 2 openings left available, so someone I know was signing up. So yeah, Carol Poppy runs those classes, and they're very popular and usually full when she runs them. Okay, thank you.
That's it?
Questions?
Okay, next item, resolution accepting the donation of 2 vehicles from Aging and Handicapped Transportation Incorporated for use by the St. Croix County Aging and Disability Resource Center. That's a lot of.
Thank you, Mr. Chair. These are 2 vehicles that we had been leasing from A&H Transportation for several years, actually, before I started here. They're now wanting to donate these to our ADRC. I know Ken can add to this, but because of the donation amount or the value of the vehicles, it exceeds what he's able to approve without board approval. But these are vehicles we currently use in the ADRC. Kristen Newton's here if you want specifics about how those vehicles have been used. But our intention is to continue using them. They still are in good shape and everything. One of them was bought with cash by the nonprofit, so that would be ours to trade in or sell. And the other one was bought with or was purchased with a federal transportation grant by the nonprofit. That one, if we were to sell it or trade it in, the revenue from it, as I understand in talking with Kristen, would be subject to the federal government, because it was purchased under a federal grant, whether or not we could keep the proceeds from that and put it in a trust, or whether some of those proceeds would be, the value of the vehicle would be redistributed, the revenue would be redistributed to other ADRCs. But we have included these vehicles, both of them, in our KIP requests going forward as a part of our vehicle rotation. So the only thing, and unless Ken has, he probably has better insight into this, but the only thing I'm a little bit, that might end up costing us something is the vehicle that was purchased with the federal grant, and whether or not we can keep the proceeds from that if we trade it in or sell it going forward. Either way, the KIP funds that we've associated with these 2 vehicles are currently in our proposed KIP plan. So our intention is to accept these if you approve.
So we'll be saving $2,000 annually? Is that the
That was
lease?
the leasing, what we were leasing them for from
Yeah,
this.
so we won't have
nonprofit.
that expense anymore.
No, we would assume the vehicles, yeah.
Is there a motion?
Yeah, I move to approve the resolution to accept the donation of the vehicles from the Aging and Handicapped Transportation, Inc.
Is there a second? Dave? There's a motion and second on this resolution. Is there any more discussion? Oh, I'm sorry. Okay, go ahead.
Thank you, Chair. How many miles are on them?
Kristen might have that detail. I know it wasn't high mileage.
Yeah. Do they
They're
get-
older, one of them's older,
Yeah,
but.
it's like 14, 16
yeah.
years old.
Kristen, do you know?
Yeah, roughly 20,000.
Oh,
on the
okay.
bus. That's a 2011.
Okay. And do they get used weekly or
They get used every week,
daily?
yeah.
Okay.
Yeah, both of them. Glenn,
I'm just
one
thinking,
of them, sorry.
like the
I could
church
have
bus
her
sits
come
around,
up
the brakes fail on them pretty regular, so.
We have a grant that covers maintenance
Okay.
costs and has paid for those throughout our leasing agreement, so. And our intention would be, also just to add to that, our intention would be to apply for another federal transportation grant, the same one that was used to purchase one of these vehicles. We can reapply for that money in August to help offset either the cost of a new vehicle or, well, that would be what we would use it for. But,
Okay. Thanks.
all right.
So just to clarify, how many miles is that? I didn't hear it all.
Kristen, you want, what was it?
Oh.
Kristen can tell you, and I won't have to play phone here.
Thanks. So the 2011 minibus that's out in Glenwood City has about 20,000 miles. And the 2017 Caravan, the minivan, has 64,000 miles. That one's used more regularly than the bus.
Okay, thank you. Is there any other discussion? Hearing none, all in favor, say aye.
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 Opposed, say nay. Abstain? Motion carries. Public health permit fee schedule. Who's got that today?
Mr. Chairman, I ask Lori Diaby to come up and explain the fee schedule. Every couple of years, roughly, we present this proposed fee schedule for inspections, public health inspections. And as the county grows and the kinds of facilities that we inspect change, and inflation and all of those things occur, we want to look at our fees and adjust them accordingly. So I'll let Lori explain better.
Do I have to push something? No, I'm good. Okay. Good evening. We do usually come every year with these, so you may remember me here. Oh, we do usually come every year for these because our goal is with the licensing and inspection program, and we've always attained that goal, is we keep it so that we're not putting tax levy into these programs. These programs are fee funded. And so that's why we monitor them very closely, working with Faye to make sure that our fees are covering our direct program costs. So before you, and in your packet, we tried to simplify how we presented these. But on the left column is all the license types and then the fees that are in the program. And then in the next column is the number of permits that we issue each, well, currently, based on our current facility numbers. And then the blue column is what we're proposing for our fee schedule for beginning April 1st of this year. And then the last column is simple math, the number of facilities times the license fee, and that's the revenue total. The adjustments that we plan in the second column, the blue column, is because our license facilities have been increasing in the county. The last 2 years, we've not had to increase the license fees because we're collecting more revenue because we're issuing more licenses. So once again, this year, we're not proposing to increase the fees themselves, but the state, we pay a fee back to the state. So that proposed fee is the number that's there. It's what we collect for our local license plus the fee that we have to pay to the state equals that total amount. The part that we have to pay to the state is what went up 1%. So that's where that 1% comes in. And then the other adjustments that we made, the state periodically adds, subtracts, adjusts, changes names to the different license categories. You can see there's a lot of them. This last year they added 8 new license categories. So we had to incorporate those into our license fee schedule. And the other adjustment that we did was we did some equity adjustments because over time when we do have to do the percent fee increases, sometimes similar types of licenses, they get kind of out of whack between that and when they add new license categories. So I called it equity adjustments, but really what that means is that if you have 2 license types that are similar in complexity and similar in the amount of time that it takes for the inspectors to go, then we want them similar in fee. So there were, how many? We did 5 of those adjustments to get them equal. So that's basically kind of how this is laid out. I don't know if you have any questions. Then on the bottom is where it has the revenue and expenses. I'll just stop there and I don't want to go too much detail if you don't have any questions.
So we don't get rich off of this, that's for sure, right?
Nope. We're not allowed to make money. The way the contracts are written, and these are estimations, so like with an 11,000 surplus, that's pretty close, But we're not, the way the contracts are run is with the state, it's such that we're not supposed to make money on the program. It's supposed to be set up so that you're charging what it costs for the program only.
So what is it, $18? No. I see, well, I lost it here. Oh, bed and breakfast. We got tourist rooming house. Is that like Airbnb or?
Yes, people would advertise a tourist rooming house on Airbnb. They also advertise bed and breakfast. The difference between a tourist rooming house and a bed and breakfast, they both look the same. They look like a house. It's a uniform dwelling. It's not a commercial building. The difference is a bed and breakfast, they have to be owner occupied, so the owner lives there and rents out individual bedrooms, up to 8 rooms. A tourist rooming house, instead of getting a key to the bedroom, they get a key to the whole house. So it's renting a whole unit.
Okay. Any other questions?
I move to approve the fee schedule for 2024.
Is there a second?
I second it.
Any other discussion? Hearing none, I'll vote aye. Oh, go ahead.
I just had one comment that maybe, I don't know, people realize that when we do the inspections locally, there's a lot of education that's involved also, which is really a nice part of it, that we know what's kind of going on in these facilities, so. And I think our licensing and inspection program, since I worked in, supervising that program, I think they do a really nice job. Lori does a really great job on that program, so.
Thank you.
Any other discussion? Hearing none, all in favor say aye.
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 Opposed, nay. Abstentions? Motion passes.
Thank you.
Information on bills pending the governor's signature.
Thank you, Mr. Chair. I thought I would bring your attention to some of the bills that are relevant to human service work that are either before the governor or have been signed into law. Some of these would have a significant impact on our budget once they're fully implemented. So let me just walk through them real quick and see what questions you might have. The first one is, it's listed as a waiver of IMD restrictions. IMD stands for Institutions for Mental Disease, and it's a Medicaid law, Medicare/Medicaid law that was put into effect when Medicare was established back in the, late 60s, 68 maybe? And IMD restrictions are intended to prevent Medicaid dollars from being spent in larger institutions. Like in the way this is written in general, it's institutions that treat people with mental health disorders with more than 16 beds. The idea at the time was to move away from large institutions for mental health and move towards community-based care, which in smaller facilities and fewer beds in theory, to provide better care. So it's a good concept, right? But the problem is that right now we lack psychiatric beds or mental health beds, and there aren't a lot of smaller facilities to refer to. So Winnebago ends up being one of the primary places where we refer people, where they end up going as a result of no other options available to them in our community. And that costs us about $1,400 a day for somebody to be placed in Winnebago. And it takes them out of our community, et cetera. So what this would do, this AB 616 and the Senate Bill is 635, what it would do is allow the state, or it compels the state, to apply for an 1115 waiver, a federal waiver, that would allow Medicaid dollars to be spent in IMD facilities like Winnebago. There's caps to that, so it's not, somebody can't be reimbursed for more than, I think, 30 days out of a year. But still, that's a significant amount of money, and it would help us cover our costs. It's mostly tax levy that pays for that right now, so it would reduce those costs once DHS acquires this waiver. So what this legislation does is it tells DHS you have to apply for this federal waiver that would allow Medicaid spending in IMD facilities. That process takes a while. It's not just a piece of paper. It's a system-wide reform effort, and it requires a lot of effort on the part of DHS to get this accomplished. It was something I was a part of in Minnesota, and it took a lot of time and dedication to get it done, but they did get it done there, and it resulted in a better outcome for at least county budgets when that was finalized. So this is before the governor to be signed, hasn't been signed yet, as far as I know. Any questions about that one? Yes.
So it would still mean that we would have to use a mental health facility within the state of Wisconsin and not cross the river, right?
Yeah, it would be specific to the state of Wisconsin, yeah. But Minnesota has this waiver already, and it allows for some of that there.
We still have to go to Winnebago.
Well, yeah, I mean, right now, as our options dwindle,
And yeah, it's
yeah.
dwindling.
I mean, a lot of our efforts are intended to prevent that. Co-responders, the community-based case managers and peers, they're all intended to work with people in crisis at a level where they can stay in their house or their community and not have to go to a hospital or jail or something, yeah. But right now, I mean, that's becoming and there are fewer and fewer options with the closure of HSHS in Eau Claire. Any other questions about that piece of legislation? Okay. So it might be a while, but it could result in some significant improvement in terms of our spending, at least. Like-kin placements is a bill that was signed by the governor last Thursday, I think. It was after I wrote this, but that allows for kids in out-of-home placement or being placed outside the home to be placed with relatives who might not be immediate family. There's funding that's attached to that. The challenge with this particular bill is that while it's in effect now, where we could place kids with relatives, a cousin first removed or something, if it's better to keep the child with a relative, a known relative, than it is to place them in foster care or some other out-of-home option. Then we could do that now. The problem is that the funding attached to that hasn't been finalized. So we're not clear yet on how we would reimburse people who qualify as like-kin under this legislation without that clarity from the state. Their plan is to use TANF dollars, as I stated in here, but the mechanism for that hasn't been figured out yet. So I'm kind of keeping our eye on that to see where it goes and how soon we can expect to have reimbursement for like-kin placements. But that one's signed into law. The other one that's pending signature from the governor, it's passed the legislature, is crisis urgent care and observation facilities. This is the $10 million that's been already allocated towards this kind of effort by the legislature, but hasn't been appropriated. So what this does is it compels, again, DHS to they have to write administrative rules around this level of care, this regional crisis urgent care, crisis stabilization facility. The idea, I think, is to have 3 regional facilities around the state where people could be seen for behavioral health crisis kinds of needs or addiction-related needs like withdrawal and things of that nature. And again, it's an option lower than a hospital level of care, but more, it's a 24/7 kind of facility, so it would be a place where somebody could stay for a short period of time, probably 5 to 7 days or something, while they stabilize and they get reconnected to support in the community. Again, that'll probably be signed by the governor soon, but the funding, in order for the funding to be released, DHS has to write the administrative rule. It could take From what I understand from DHS, it could take about 1 to 2 years for that to happen. And then they would have to put out an RFP similar to what they did for withdrawal management a couple of years ago. And then we would have to apply for that money if we wanted to pursue this. There's no indication of how that money would be distributed to 3 different regions, if it'd be equal amounts or what the time frame is. The intention behind it, though, it ties in with the very first legislative item. The intention behind it is to be startup money for a facility like this, followed by funding that would be acquired through the 1115 waiver, the federal waiver that I talked about, as an ongoing Medicaid support for this kind of service, like a per diem rate or some kind of Medicaid rate attached to that service, which would sustain it in theory. So that's the idea, right? Get it started in 3 regions and then continue funding through Medicaid if they can work out a waiver with the Centers for Medicare and Medicaid down the road. So both of these items are kind of tied together in some way, and it could be 1 to 2 years before we see action or something that we can actually respond to. Yes, sir.
Bob, and with that right now, basically all we've got is Winnebago and La Crosse, correct?
Amory, we use, who else?
As far as centers where we're sending folks?
Mayo Clinic, yeah. It's very limited. The closure of the hospitals in Eau Claire really put pressure on this region to find alternatives. L.E. Phillips also closed, or will be closing in Eau Claire, which provided 21, I believe, beds for people needing withdrawal management. And it's the only facility anywhere near us that did that. So there's an urgent need in this area. Again, we've had these discussions about, could we do it at Kitty Roads? Could we do it somewhere else in this region and have other counties partner with us and make it work? It's a possibility still, but we also need dementia care. A dementia care unit, as Kitty Roads was originally intended for, and we have trouble with workforce around that area. So it's kind of which thing comes first and which is more viable. But yeah, so the options are very limited, yeah.
And is my understanding that we lost another hospital in Chippewa?
Well, the
Chippewa
2
Falls?
hospitals are closing in Eau Claire. I think the date was moved up to this Friday, for the closure of those hospitals. And Prevea will continue operations until April 21st or something like that, as originally scheduled, yeah. Prevea Health Systems. So I don't want to go off track too much, but there was a call yesterday about this, and area hospitals in Eau Claire, Mayo Clinic, Marshfield Clinic, and a cooperative within Eau Claire, a nonprofit that's trying to get started, are looking at solutions or answers to this increasing demand of patient needs. There are no good answers right now, so we'll have to see what comes of this. But it's a shock to the system right now. Any other questions about the urgent care piece? All right. I'm guessing that would be about a 2-year grant if they get around to ever getting it out. Xylazine test strips. Xylazine is an animal tranquilizer. It's not an opioid, but it's making its way into the drug supply. It's a very powerful sedative, much like fentanyl in terms of its impact. And they have xylazine test strips that we can use to test drugs for xylazine to help ensure that people don't overdose accidentally on a drug. But xylazine test strips have been classified as drug paraphernalia in the state law. So the concern was, can we distribute them because they're listed as drug paraphernalia? This legislation was intended to remove that designation as drug paraphernalia and allow counties or anyone to distribute xylazine test strips, much like we do fentanyl test strips, to ensure that people don't, or help ensure again, that people don't overdose accidentally, or they know what they're taking if they're going to take a drug. That passed the legislature and it's pending approval from the governor. Any questions about that one? Oh, yes.
So since it's considered drug paraphernalia, or it was, is there a specific disposal process for the test strips? Because is there xylazine present on the strip when you're done? Is there a special way of handling those that's different than the fentanyl ones?
I'm trying to remember if in the instructions for how to use test strips, like fentanyl test strips, I'm thinking there's instructions for how to dispose of it, but I don't remember what they are. It's a good point, though. I actually didn't think about it until you said that, but it triggered a memory of reading that on the.
Well, we
fentanyl
might
test
need
strips.
something like what they do with sharps in bathrooms or something, where it's isolated, right?
Supervisor Leaf, I'm pretty sure there's language in the instructions, but I'll keep an eye on that. It's also important to remember that, like, Narcan will not reverse the overdose of xylazine, so it doesn't work on xylazine. But if somebody's taking a drug that contains both opioids and xylazine, at least, you would want to give them Narcan to see if it reverses the overdose of the opioid anyway.
I think this is good. I'm just wondering about that other piece of it.
Yeah, I'll have to check. I don't know. I don't know that they have instructions yet for xylazine. Yeah. But I think that was all I had, unless there are questions.
Any other questions? No. Okay. Thank you, Bob.
Yeah.
Any requests for future agenda items? Okay. Announcements or correspondence? I believe Dave has something.
Board members, I would like you to know that this will be our third year with a mental health symposium. And I was hoping that you would please join us at the symposium for our emerging adults, which will be on May 1st from 5:30 to 7:30 at the St. Croix County High School in Hammond. It's a collaborative effort from our HHS, Veterans Services, and Justice Support Services departments, and many local partners who bring awareness to the mental health challenges for our young folks. I encourage you to attend and help us spread the word. And if you know someone who may benefit from this program, please share the information that we're going to be passing on to you in a couple weeks. We're going to work with Adam, and we'll have some stuff out for you on there on the entire program on that one. So mark your calendars, and you are more than welcome to come and please join us. It's a fantastic group.
Thanks, Dave. Any other announcements?
I just wanted to update you all on the status of hiring for Public Health Division Administrator and Health Officer. We have interviews scheduled for the 29th of this month. We have 3 candidates currently that we're looking at, and all very qualified, so we'll try and make a decision shortly after that as to who our candidate selection would be, and then the board would need to approve our recommendation for that position. So I'll be announcing that as we get closer to the date where we have a final candidate, but it'll probably be the May county board meeting that we would have that on the agenda. And the other thing I was going to mention real quick is, no, it was what Supervisor Osna said, so I guess I'm all done.
Any other announcements from anybody? Hearing none. Date of next meeting is scheduled for April 17th, back here, same place. No? I was wondering about that.
No, you won't have an April meeting, because we won't have, yeah,
Okay, I
we'll
told,
be unorganized at that point in time.
well, we won't be organized by then, so we won't have a meeting in April. Yay, no. Anything else? Any last comments? The meeting is adjourned. Thank you.